Guys, what is my opinion about how you should treat cholesterol in heart disease? Let me just tell you, heart disease is the number one cause of death worldwide, man and woman, um, and is basically because of lack of preventive measures. First thing that I would recommend you do, look around you and see in your family how's the risk of that. Minimal, check your cholesterol once a year. And there's a big split in social media about cholesterol medications. By the way, I'm not driving. My car drives. It's a Tesla. We have to supervise it and it looks pretty good. So it's safe. Um, so back to the cholesterol, I had to make that statement because sometimes people go, oh my God, you're driving. No, I'm not. So I apologize. I have to do that every day, every time I'm here. But this is the time I have. That's why. Anyway, cholesterol. So how you approach your heart disease? Well, I work with a cardiologist because I don't know it all. And if a doctor that's doing functional medicine or running your medical care thinks that he can do it all, no, I have a nutritionist too. Why? Because I know a lot of nutrition, but sometimes people need very specific fine tuning. And if you do these, if you're gonna say you do precision medicine, you have to have consultants. You have to have people that are the actual experts on that. I know enough to solve most problems, but then there's other stuff. When I find real problems, I get you to the right specialist. So that said, what you do is if you are a man over 50 and maybe over 40 if you have heart disease, you should have seen already a cardiologist once to get some testing done. For example, echocardiogram, stress test. Now, stress test doesn't discover early heart disease because usually it will be more advanced. So if you're fine tuning and trying to get to the bottom of things, I'm going to tell you what to do if you want to be ahead, okay? And that's the whole goal here because you have been forming plaques in the arteries since you were born, pretty much. And it accelerates later on in life, of course, because of the poor choices we make many times, but also sometimes genetically. And we're learning more and more. So, first step, look at your family, high history, you better get sooner to a cardiologist. Second step, what is your cholesterol looking? Nowadays, we have a couple of tools that help you. Focus on your LDL. That thing that they used to say, or that some doctors still say, or some people, good, bad cholesterol, erase that from your vocabulary. Focus on the LDL. Focus on the particles. The cholesterol is not good or bad. The cholesterol is just cholesterol. Okay, cholesterol is inside the envelope of lipoproteins because it cannot float in the blood without it. So that's what we call it LDL, HDL. Focus on the low density lipoprotein, LDL. Focus on the non HDL. HDL is not going to protect you if you have elevated cholesterol. So remember that. And in some cases, that high HDL is pathological. I'm not going to get into that now, but that's why you can't focus on that. A more absolute and important number is your ApoB. I know these are crazy names, but if you can remember, write it down. If your doctor looks at ApoB, what that's going to tell you is the number of particles that are atherogenic, form plaque. Okay. Now, that number is more an absolute better number to focus on when you're getting treated. That's going to be in the future the most important one. There's another number called LP little a. That may be something you check once in your lifetime when the therapies for that come in. We don't have a drug that lowers it significantly. You may want to get into that. You want to repeat it, but right now get it because this is all risk assessment. We're trying to understand your risk. to determine the aggressiveness that you will need. There are new guidelines, okay? The more risk, the lower your cholesterol should be. And again, they're going to jump now to my neck and say, oh my God, now wait, because cholesterol is not the only reason your cholesterol is high or you're forming plaque. Okay, so we got to be smart about this. So I'm giving you a method that you may want to follow. And everybody has their style, but I think this worked out for me and some of my patients. So once you get that information, you understand now risk and you understand where you are classified. This is a numbers game. The higher the particles floating in your blood, the higher the chances you're going to form more plaque. There are other factors that we want to control. I'm going to get to that. So you want to lower that. That's the low hanging fruit. Can you do it naturally? You can try. I always give people the try. Do it. You have time, so do it. And then in 1 to 3 months, 3 months is probably a more better number. See where you are after you make real adjustments in diet, lifestyle, whatever you choose. That number may go down 10% and may be enough in some cases, but in most people, it will not be enough. You can try supplements. A recent study demonstrated there's no supplement that matches the drugs. You can try berberine. You can try omega 3s. You can try, um, what else? All the different uh, modalities out there. There's a million supplements. You can add that to your lifestyle changes and see if that made it. That's okay. But if you have to be in a statin because you're not budging, that will drop it down. And if a statin scares you, research and pair with your doctor. Statins do have side effects, not in the majority of people, in the minority. So that's the cheapest way and it will work. Sometimes you have to be in a statin and an oral medication. Don't be afraid of medications, guys. Medications are like supplements. Sometimes people go take the supplements from an unknown source blindly. These medications, they have clearly stated the side effects. You understand them. If you get it, we can change it. So that's not the end of the world. But it always surprises me. People are taking 10 supplements when one pill can solve the problem, those 10 supplements. So that's what I would start with. And then play with it as you go and see what you can do. You will reduce the risk of plaque formation. You will reduce the risk of heart attacks. And some of these studies that say does not reduce all cause mortality. Well, of course, because this is looking at reducing cholesterol and reducing plaque formation, and that works. And sometimes there's plaque regression if it's soft plaque. That brings me to the next step. If you do have high cholesterol and you have suffered for years with that, and you have high family history, over 40, mostly over 50, do a calcium score. That doesn't tell you anything but that you have active and you have been suffering from atherosclerosis or of ASCVD. That tells me you're at higher risk, and depending on the number, you know, you want to see that trend and how it changes, okay? So it's important to get a baseline and look. If you're really high risk and you have a high level of that and your cholesterol is elevated, I would consider doing a CT coronary angiogram. And some people will jump to my neck again, but I think that's outside the box. Why? It gives you an idea of how much soft plaque you have, and it can give you, if you add clearly, and there's more modalities coming out, it tells me flow. Is this really causing problems? Now, some people will say, well, why are you going to do? Patient has no symptoms. The current standard says a artery, coronary artery blocked down to 70% with symptoms is the only time we act. I think that's outdated, and I think that may be revised, but then it tells you you got to be more aggressive. Because if you have a 50% block, no symptoms, but the flow is slightly impaired, you may want to improve that. And you may want to be on medication. I would say you want to be on medication. So that's, in a nutshell, the workup I would imagine makes sense. There's tweaks to that. There's some people more aggressive to that. I'm just giving you a frame, uh, an idea of what you can do. And then at some point, if I find you're high risk for that, then I'll refer you to a cardiologist. The part I did not address is what are the other factors. You got to look at your insulin level. You got to look at your sugar. You got to look at your A1C. You got to look at your HSCRP, inflammatory markers, set rate, homocysteine. All these things are important because they're part of the picture. If you lower your cholesterol and you keep the inflammation high, you're having still problems. You optimize inflammation, lower your cholesterol. Are you going to form plaque even without inflammation? Yes, I see it every day. People with normal markers and everything is good, but the cholesterol is high and they're forming plaque. They're progressing. So that's why it's important to look at it in a whole picture and not just one place. It's complicated. We have the tools, get a team assembled, and then uh, let's correct all the things. You have to put your 2 cents in this. You have to be cognizant that you got to change lifestyle. And, the reason we have progress in medicine, people don't give credit, but for the last 100 years, we have decreased with the current standard of medicine, increased lifespan by 30 years. Now it's slowed down now, and it has been affected also by lifestyle choices. And the fact that you live longer gives you more time to develop chronic illness. This is why you're seeing sometimes an upswing. People live longer, so they have more chronic illness. And that's putting a dent on the end of your life, basically decreasing the longevity at the end. So we got to correct that early and prevent it. That's the whole picture here. Why there's a split and a disconnect? Because some people believe cholesterol should be left alone. That is not the case in some people. Okay, so that's the key of when you're talking about medicine that is precision medicine or personalized medicine. You have to fine tune to the individual. When you try to lump it, say everybody should eat this diet, everybody should take this, it is a problem. Okay, so um, I hope this helps. And if you disagree, that's fine. I have come to this through a lot of research and looking, and I do that myself. I'm one of those people. Oh, one more thing, hypertension. Let me tell you, if you smoke, don't worry about it because you're destroying yourself. Stop smoking. Hypertension. People say I don't have high blood pressure. Guys, invest in a cough. Even if it's normal, it can happen overnight. It's silent, the silent killer. Why? Because it's quiet. That also causes blockages or promotes damage of the blood vessels that will lead to a blockage. So get a pressure cuff, check it at home, check it in the morning, check it in the evening. Don't be obsessed, but check it. There's apps now that you check it, you don't have to write it. It goes straight to the app. That's what I do. I had hypertension. I was able to take care of it. Another video for that. But monitor that. I can see sometimes in people's faces they're hypertensive, and I ask them, they say, I don't have it. We check it. What is normal? 120 over 80. Anything above that is hypertension. Okay, and that's another confusing thing because the guidelines have been up and down. That's still the guideline, 120 over 80. And if it's a little lower, even better, especially as you get older. So bear that in mind, keep that in mind. It's very hard to control. There are many factors. Some people are sodium sensitive, some people are not sodium sensitive. And so get a workup, try to find out. All right. I know it's frustrating, but this is what it takes to be precise and do it right. I hope you have a good day.